Good morning, everyone. Welcome to the webinar for HCP, Conversation, Who is HCP and What Do We Do? My name is Carla Rowland, and I am going to just go through a few housekeeping items before we begin. Again, we want to thank you for participating, and if at any time you get disconnected, please sign out of the webinar, and using the link provided to you after you registered, you can join the webinar again. If you're having problems with the audio, please check to see if you have chosen the phone option or the mic speakers option. If you're still having problems, you can message us through the chat function, and we'll work with you to get you on. All participants are automatically muted. If you have any questions or comments during the webinar, you can type them into the chat box, and we will be taking questions as we go along. If you prefer to speak using your telephone or computer's microphone, you are also welcome to do so. You will click on the hand icon, which means you're raising your hand with a question or comment. On our end, we can see that a hand is raised, and we will unmute your line. So thank you again, and I'm going to turn it over to Jenny now. Thank you.
Good morning, everyone. This is Jenny Muntali. I'm the HCP Unit Manager. Thank you so much for joining us this morning. Those of you that are in Denver will have people popping in a little bit late because we have pretty bad weather. And so hopefully all of you joining us by phone are a little bit more comfortable. Before I introduce our facilitator for this morning, I just wanted to say a couple words about some of the background about how we arrived at this conversation today. So over the past year, we have participated in many conversations regarding the HCP program. And in almost all of those conversations, the topic has arisen that we need a consistent way to describe our program across the whole state. Many of the partners that we work with are confused about our program, what we do, who we are. And so as we've been discussing this, we decided to first get input through the survey, and then we decided to have more like a community conversation, which is what we've invited you to today. We have the counties that are participating today are up on the screen right now. They're on the welcome sign, so you can get an idea of who's participating. In some cases, we have multiple people from the same county at one site participating. So we're looking for your input today, and what I'd like to do now is turn it over to our facilitator, Kathy. Before I do that, I just want to remind you that we're recording the webinar, so everything that you say as well as everything that you type in today will be recorded, and we'll make that available for those people that were not able to join us today. So I'd like to introduce Kathy White, who is an MCH generalist consultant. Many of you know Kathy. She's been with our program for a long time, and she has graciously agreed to facilitate our conversation today. Kathy?
Thank you, and welcome everyone, both online and here. We all really appreciate you braving the weather, whether you're in San Juan Basin or you're here in Denver. It's probably equally bad. We have a number of counties represented here around the table. We have Jefferson, Tri-County, and Denver here that will be representing their counties, and they have some of their other staff that are online. So I wanted to start this meeting out with talking a bit, very briefly, about the purpose. And when you're looking at your agenda, which I'm hoping that you all have, you'll see at the top the purpose of this meeting is to receive input from all of you. Especially all of you that are implementing the HCP program, and that's going to inform a one-pager. We'll learn more about that one-pager a little bit later, but then with the meeting outcome, we hope at the end of this meeting to have some agreement on the content of this one-pager, and keeping in mind that what we're wanting to do is to consistently describe the HCP program and what we do. And having been here a while, you know, I started as a child here, but having been here a while, I've heard that comment over the years that we want to be able to describe in general and consistently across the state what we actually do in HCP, and that's what we're going to try to come to some agreement today. So let's get started. Hopefully you've got two things. One, the agenda, and two, that you've got the survey in front of you. So I'm just going to test this out. So if anyone doesn't have the survey and access to the survey, would you please write a note to Carla? Otherwise, I'm going to assume that everybody has a copy of the survey. Now, I'm going to remind you, and I probably will remind you several times, that we want the document to be reflective of all the work that HCP does. And I know that some of the agencies may not do all three things that HCP represents. So we're going to talk about care coordination, and we're going to include specialty clinics, and that's where some of you may not have specialty clinics. And we're going to include, we want to make sure that we include medical home when we're talking about this description of HCP. So you saw that we have the listing of counties up there, and I would urge you also, those of you that are online, if your county is not represented, to send a little note to Carla, and she will make sure to enter your county. So let's get started. Today we had 26 people participating online, at least registering to participate online, and as I said, we have a number of program staff here, and we have 3 different counties represented here on live. So during the meeting, follow Carla's instructions, because this is a conversation. I know there's a little bit of difficulty doing it electronically, but we want to make sure that you have the opportunity, all of you, to make comments, ask questions, and make some agreements. So please either raise your hand or write comments as we go through, and we'll be stopping briefly throughout. So to me, let's go ahead, and we have about 50 minutes for discussion. We can expand that a bit, but about 50 minutes. So I have my timekeeper beside me, Rachel, and we're going to try to stick as much as we can to the timeline so we can get through all the materials. So if you'll pull out your survey results, let's start out with a survey. And you can see up on the screen, first of all, we want to thank everyone for taking the time to fill out the survey, and notice that we had 63 respondents, and of those 63, it's representing 51 of the counties. So we really had received a great response, and thank you all. So let's just quickly look at the demographics here. And this first slide is how many years have you worked in HCP in any capacity? And wow, we really have an experienced group. So we have over 40% have been here 10 years or more, and with another 50% of you in total having been here 5 to 10 years. So we've got, you know, a huge complement of very experienced individuals that responded to this. Of the 63 respondents, you can see with the next slide, if you put the next slide up, thank you, that 33 of you listed yourself as HCP care coordinators, either in combination with clinic or separately as care coordinators. And 6 of you specifically selected the specialty clinic coordinator, which the program is especially pleased with, that all 6 sites that specialty clinics are held on are actually represented, and we think that's very important. We noticed that there are a number of different titles that you function under, but 46 of you responded that you were nurses by profession, so we can certainly see, and that's been the case over years, and we're pleased with that. So does anyone have any general reflections or questions they have about the demographics? Okay. Carla, nothing? Okay. So let's go ahead and move on. And here's how there are 4 main questions that we're going to try to look at and discuss. And the program would like you to consider, as you're looking at these 4 questions, what really surprised you or what stood out for you, what themes or topics arose, and what topics from the survey responses that you feel need to go into the one-pager. Okay, and we're going to repeat those questions throughout it. As I mentioned, we have about 50 minutes for discussion, so I want to say this now, and I'll say it at the end. If you have additional comments, feel free to email those comments to Jenny Mathali, and they'll would be placed with the discussion and the final draft of the document. So let's go into the first question. And that question is a ranking question. And it's actually on page 3 if you have it, if you're following. This is asking, please rank the HCP descriptions that were given to you in the survey from a 1 to a 9. And how we've organized the responses of these surveys, the top responses are the ones that have the highest ranking. So just a minute, take a look at those. And I'm also going to assume that you've already looked at the survey too, so I'm not going to give you a lot of time to review things, but take a minute to look at the survey.
Kathy, can I chime in? This is Jenny. So also in that ranking, as Kathy said, the ones at the top were the highest ranked, which means that respondents felt like those descriptions best represented HCP.
So I'm going to go ahead and move this on.
There's a hand up.
Oh, okay, good.
There's a hand up, Fatima Herrera. Okay, you want to unmute her?
Okay, go ahead, Fatima.
Oh, I just wanted to let you know that I didn't have a survey.
Okay, if you don't have the survey, you can go to our website, hcpcolorado.org, and there's a tab that says Guidelines and Forms for LPHAs, and at the top of that tab it says HCP Survey, and you can pull it up from the website.
And Fatima, you should be able to see the question that we're talking about right now on the screen as well, but I'm sure you'll want to have a copy of the survey response. Okay, so I'm going to ask for some agreement on this item as well. As Jenny said, it looks like the top items are the ones that you all mostly felt described the HCP program. So we'd like to focus on the top 4 items in there. Unless anyone has an objection to that, we'd like to go ahead and focus on those items. Now remember, what we're trying to do in this one-pager is describe what HCP is. So can you focus in on those top 4? Understanding that number 4 on there, really HCP provides access to pediatric specialty care. We'll be including specialty care, but we realize that not all of you are having specialty care clinics. So let's look at those items and let's begin our discussion. Anything in particular stand out to you? Any surprises or anything in the words or the phrases in these top 4? Molly, do you have any thoughts?
For me, I think probably the top 3 do embody how I described HCP over the years. So they seem to capture that.
Okay. So Molly Benkert from Denver has said that she thinks the top 3 really do embody the words and the descriptions that she has used for HCP. Anyone online have any thoughts, both pro or con, if you have any concerns about using these top 3?
I think,
Go ahead, Carolyn.
this is Carolyn. I do think in looking over all of them, these 3 provide a picture of what the minimum we're all able to do, whereas the lower things get more specific.
More specific. So in case I'm just going to repeat that a little bit. Carolyn from Jefferson really felt that the top 3 do embody the work that is consistently done across the state. Any other responses online? No. Okay. So would you all, and here, oh, Jane.
This is Angie Fisher, and
A little bit.
I have a cold, so I apologize. But we're still talking about the top 4, or the top 3, the top 4. So The only comment that, or thing that I had that I thought about was with the fourth one, perhaps if it was worded differently to represent that whether you have specialty clinic in your area or not, that there may be referral or help with access to specialty care. So my thought was that you could expand it to 4, perhaps if you did some rewording around that fourth one.
And let me just, I think that's a great point. In case Angie has a little cold, so in case you didn't hear it, she was advocating to still be looking closely at number 4, that HCP provides specialty care in the rural areas, and crafting the wording around that. And for all of you, that will be what will happen with these statements, that there will be one or more statements that will be crafted from these to really encompass the description of HCP. So she's advocating to include specialty care.
Well, and perhaps reword it even,
and reword it.
That it's not even just the rural areas, but even the urban areas would provide a referral or even help, you know,
like
reduce
HCP
barriers to
facilitates
access for those.
Yeah.
So some different wording, so it would be, so you could expand on that and say we actually have clinics, or you could say that they just help access by referrals or whatever to clinics. So, to another, it could be Children's Hospital first.
Great.
Kathy?
Yes.
We have about 5 comments.
Okay.
So we'd like to read them because they're coming in writing. Is that okay?
Okay.
So the first one says, I like that the third one, so the third one down, addresses the need for the family to be able to manage. So it lends to, you know, the building the family's capacity. And then another one says, I too agree that the top 3 statements reflect best how we describe HCP services. The next comment says, that would be providing the tools for the family to be able to work on their own. So again, kind of lending to this idea of building the family's capacity. The next comment says, and the 5th one does speak to the smaller agencies.
The 5th one.
The 5th bullet. So, so HCP coordinates on behalf of families is the one they're referring to. And then the last comment says, thank you, Angie. I agree. I think specialty clinics are important to include somehow in the HCP description. And then another comment just came in. I would suggest remove the word rural in number 4.
Okay.
So, we have quite a few suggestions there.
Great comments. Thank you. And we're taking notes of all the comments, so all of those comments will be noted and will be used in developing the final draft. Yes, good.
This is Jane. I just have one more edit or addition. In 2, I think that if we added HCP provides information and resources to families and communities, or families and agencies, that might be more comprehensive about what HCP does.
So Jane is proposing that we add the communities words to that. So, and that's
bullet number 2.
Bullet number 2. Now, Jane, I wondered if you might have noticed that, because remember we talked about we want to make sure that we're including care coordination, specialty clinics, and also medical home. I'm wondering if you feel like medical home has been incorporated into this, because there is a specific one that's at the bottom that supports medical home, but maybe the wording is different.
No, I don't think that it really is addressed in those first 3 statements. I mean,
so we may
it's
need
the
some
systems
words
work versus the individual family work that is provided.
Now we have some opportunity in the next question to really dig down a little deeper. So I want to make sure we can move on. But before I leave, are there any other comments or any other concerns that we haven't addressed here? No. Okay. So I'm going to suggest that we move on to the next question. Now you'll notice the next 2 pages as we're moving through this are really reiterating the first question, and it was broken down into large counties and small counties, and amazingly enough, we found that both the ranking was the same of both large and small. So we're going to move on past those next 2 graphs to the next question. And the next question is, how else would you describe HCP to your partners, to your families, to your staff? How else might you describe that? And that was done by a narrative comment. So there were 24 participants commenting, but there were many more comments. And you'll find at the end of your report that all those comments are included. But the HCP staff went through the comments and really tried to find themes and words that were repetitive. So notice that you have 1, 2, 3, 4, 5, 6, 7, 8, over 10 bullets here. And at the end of each statement is a number. The number represents the number of times that either this statement or the words within that statement, the theme of the statement, came up. So what they tried to do is summarize instead of having to read through all those. So what you're seeing is a summary of the comments, and they're in a way ranked by the number of times that they appeared. So matches needs to resources and connects to resources is a very common theme that all of you thought needed to be also included in this. Does that make sense? Would you nod here in the room if it makes sense so I can okay. Okay. So again, take a minute or less to look at these, and then we find again with frequency that it might help if we look at the top 3 to 4 bullets and really focus on those, because those are the ones that repetitively came up. Okay, can we open the discussion? Again, keeping in mind what surprises you or what seems to be jumping out at you about the words or themes. What do you feel is important that is included in the description? And again, this goes with the description of the HCP program. And what themes do you feel like are coming out? And hopefully these are the themes we've correctly identified the themes of your responses. Matches needs to resources, connects to resources, helps to get to know families, which talks about your relationships, I believe, identify and prioritize needs, and this coaching and teaching families to be their own advocates. System navigation was also included in some of the other comments. So, matches needs to resources, the relationship with families, getting to know families and helping them prioritize, coaching and teaching families, and navigation. Any thoughts here in the room about these areas? Do you agree that these are common ways that you also might expand to describe HCP?
Yeah, this is Molly, and I personally do agree that they give further details about expanding what we do, and I particularly think that the coaching and teaching families to be their own advocates really supplements what we've said about building the capacity of families to manage day-to-day issues, so that we're really trying to, assist them and educate them versus us taking it on and doing for them.
And this is Kathy from Tri-County, and I really think that somewhere in here there should be something about educating families on their child's physical condition, or their, however you want to write that.
On their medical condition?
Medical condition. Somewhere in this document.
Okay. Okay.
I think that's very important.
And
it's unique.
Yes, and keep that in mind, because the next question is about the uniqueness.
Oh, okay.
So keep that in mind if we don't put it here.
Oh, okay.
No. Okay.
Kathy, we have a couple comments. Could I read them?
Oh, the Q means questions.
Right. We're trying to. Hard not working.
Now we know. Okay. Here's the question.
Okay. So there's a comment. If the county receives less than $15,000, so they're referring to counties that receive less than 15,000 have the option in their planning form whether or not to provide care coordination. So the comment is, if the county receives less than 15,000, care coordination does not apply. And what I responded to that comment was, counties receiving under 15,000 have the option to provide care coordination. So in FY13, we had quite a few gaps across the state in terms of giving counties that option. But in FY14, through the good work of Kelsey and Angie, we have talked to counties, and we only have 5 counties now that are not providing care coordination. However, while they're not providing the HCP model of care coordination, in individual discussions with those counties, they are still providing resources and information to families that call. And in some cases, those counties are providing need-based care coordination. So they are helping a family on their individual needs, but not necessarily in line with our model. So this comment is correct in that it represents something that's not consistently done across the state, but what is consistent about that is that all of our counties are providing at minimum resource and information to families. So I just wanted to kind of let you know what the dialogue, because we've been typing back and forth here, so I just kind of wanted to inform the group about that discussion. And then another comment is, I like the medical psychosocial care coordination program. These families are often very complex and have more than just medical needs. The social workers are dually addressing these issues while the nurse is addressing the medical/developmental needs. So I think this gets at the bullet about social, emotional, and also the complex cases.
Well, the medical and psychosocial care coordination. And I'm seeing nods from those of you here from the counties who are sitting around the table. Yes,
Angie, I was going to kind of piggyback on that as well, but I was more surprised that I didn't see that support guidance and medical psychosocial up the list a little bit higher, because even in agencies that don't have a social worker, they're still dealing with those psychosocial and emotional needs of families, and so I guess I'm just echoing that.
And maybe that could have been from the former question. The ranking question also had a ranking question for medically and socially complex. So we may see that, you know, that some things are duplicated and some things are not. So great, Angie. Any other questions?
Yes, there's one more comment. HCP is a state program that assists the child health program in our county to advocate for special needs families. So I think it might fit with that teaching families to be their own advocate, but this comment is actually saying they advocate, the county, this program advocates for those families in their county.
Anything here?
This is Molly, and I am going to, I guess, reiterate what Jane was talking, and I'm not sure where in this it might fit, but I do think with how we've been moving forward and with what healthcare looks like now, having something here about medical home, especially since our plans are kind of based on that, that is going to be very important to incorporate somewhere, somehow. If not to our families, certainly to our health providers or partners that we're communicating with. And I don't know exactly where it fits, but I think it's very important not to lose that concept moving forward.
So hopefully you could hear Molly, who's sitting at the edge of the table, that she feels it's very important that we have the medical home terminology, the medical home process in there. And Molly, can I ask you a question? Would you say that both the medical home work that you do with the families, but also the systems work, are you referring also to the bigger systems work? And Molly says yes. Okay. So both the medical home work that you are linking the families within that medical home process, but also the systems work that you're doing. And some other heads are nodding here. That seems to be the case. So, yeah. I'm just looking to see if there's any other comments from you all. And yes.
Okay, I think this other comment is just counties that intended to come up and attend in person and they're stuck. So they're just, they
We
turned around.
totally
That's fine.
understand. Yeah.
I didn't have my glasses on, so I couldn't read the comments.
And I'll reiterate again that there are certainly opportunities after this meeting too for you all to comment as well and send in comments.
Can I ask just before we move on from this question? I didn't get clear. I did get some of the additions that we want and a couple of the priority topics that people would like to pull into the one-pager. What I didn't hear is those first two bullets. Was there any objection from anybody to pulling in those two bullets into the paper? And the reason I asked that is because they came up so frequently. But I haven't heard anybody discuss them yet. The first two bullets about matching needs to resources or connecting families to resources and helping get to know the family.
Well, let's just ask for objection.
Yeah.
Does anyone object to using those words and that theme in the description as well? Does anyone object here?
Yeah, I'm just asking about the first two because the third one came up in our discussion and there were a lot of nodding heads, but the first two I didn't hear anybody comment about, so I'm not clear if we're including them or not.
I think because there weren't any comments, that means that it's okay.
Okay.
I guess.
Okay.
And the only comment that I would have would be under the fourth bullet. I don't know how far you're going to go down in this one, but where it says systems navigation, it's the word navigation. Is there a better word we could use just so that we are not confused with patient navigators?
Gosh, did we plant you here? That in looking at that theme, that was the same question that came up from the program staff too. A little bit of concern about confusing navigation with the navigators in the Affordable Care Act, and so I think that's a really good point. And I'm seeing nodding around the room. So certainly helping families and being a liaison is very important. But concerns here about using the word navigation. And so.
And this is Jenny. For me, I agree with you, Kathy. We talked about that ahead of time too. That in this document, we want this document to clarify what HCP does, not further confuse the issues. And I think that's where some of the confusion at the community level is between care coordinators, patient navigators, case managers. We have a lot of these different titles going around, but what are those folks actually doing? And so we want this document to really clearly speak to what do we do in our program around care coordination. So I do think we want to avoid using some of those terms that are causing confusion. And the other thing I would say is, throughout this document, we really do want to come with something that speaks to multiple audiences. As this came up in all of the meetings that we were in, people were really feeling strongly that we needed one document that speaks to families, that speaks to partners in our community, and even helps us to talk to our own staff within our own agencies about what this particular program does and how it might partner with other programs, for example, in the county or in the agency. And so I think this is really important then to not wordsmith in here, but I think the group that takes these comments away needs to really think carefully about the wording that we use so that we don't confuse this program with other programs, but we also can speak in a language that's understandable to all of those audiences.
So I'm thinking that we heard, a question.
It seems the first bullet point may be too similar to the second ranked description. So I think that they're referring to the second ranked description. HCP provides information and resources to families with questions and helps get to know family, identify, and prioritize needs. Any comments about that?
That is very similar. And I'll reiterate that these comments, these descriptions will not be taken as its full, most likely as its full description, but the words within that will be used to craft the description. So repeated may mean that it's really important for you. Now, if Carla, if you could move down to the pie chart down below. This pie chart really represents the importance these above statements have for you all. So if you answer the above question, which we've been discussing, how important is it? Well, over 90% of you said that it's important or very important. So you feel like the words and the themes in your responses are really key to being able to describe what HCP is to those partners. So that's one thing. We'll look at the themes, the craft, and craft the description with these words. Yes.
So one other comment before we move from this. This is a comment that came in online. I think it may be important to add assessments into one of these bullets in order to help show the benefit of having a trained nurse or social worker providing care coordination.
Okay.
Can I make one other comment? I was just noticing, and this actually just popped out to me, but this is Angie, sorry. But, you know, we talked about including medical home, but when I look through some of these bullet points below the 4 bullet points, I see work as a coordinated team. I don't know that that was what that intent was, but that could be with the family, with your partners, within your agency. That's a component of medical home. Systems development, component of medical home. Care coordination across a life course, so continuity, transition, all of those different pieces. I think you could make a stretch that we are talking, we're bringing up pieces that are medical home without actually using the term medical home. You know, further down, saves families money and time, etc. So I'm just throwing that out there as an observation. That's a good point.
And this is Gina. Maybe the reason medical home isn't showing up is because there's not a very clear understanding across stakeholders as to what it really means. Yeah. So maybe there's a need to use some different words, like the ones Angie read off that appeared in the survey, and then back into a definition of medical home and using that term at the end.
It is difficult to clearly define to somebody when you're talking without using a whole bunch of words.
In many of the HCP documents, even on our website, we say HCP supports a medical home approach, but we don't really say how we do that. So maybe it's, this is the additional information about how HCP supports a medical home approach. Come up in the next question that might further strengthen that idea.
And I just wanted to add one more thing before we get too far. This is Kathy from Tri-County. In our agency, we talk about, if you go back to number 4 in the first one, HCP provides care coordination services to family of children and youth with, we always say, complex special health care needs. Now, I don't know if that would transfer over the whole state or if that's just in Tri-County we really have honed in because of our capacity issues.
And Kathy, I think that's going to come up in the next question when we're really trying to identify. So it's a great point, and I would assume, I'm only assuming, that those are the kinds of children and youth that you're working with all across the state too, that would be coming in. But I think that's a great point. So let me just summarize here, and then we'll move on to the next one. That it sounds as if we don't have any objections to, for sure, using the first 3 bullets, the words within the first 3 bullets, but also adding some of the terminology and words that you're using that describe what medical home is, rather than just using the word medical home. And yes, and there's a question, so online.
It's a comment. Partners often think medical home means home health care.
Great comment. So really trying to focus on describing what we're referring to as medical home rather than continuing to use the verbiage again and again, so letting people know. So great comment. Thank you. So, okay. So let's move on to the next question, which is what, and I think this gets to the real meat of things. So what makes HCP unique from other agencies that provide care coordination, case management, or that word, patient navigation? So what really makes this program unique? And you'll notice under there the N is 51. The responses, again, do not add up to 51, and all the responses are in the back of this survey report because some of you responded more than one time, which is fine and good. So let's look at these bullets on the next page. that make you unique, make the program unique, such as multidisciplinary professionals with specialized knowledge. I think we were talking about that earlier. And the complex needs that Kathy mentioned comes in here. The specialty clinics, are very unique. So take just, I'm going to say a few seconds and take a look at these. And again, let's go through and try to identify other themes or words that are not in these. But let's try to do the same thing. You see the numbers beside it. The most commonly repeated words or themes are in the first 4 bullets. Navigation comes up in the 5th. But let's take a look and focus on those if we can.
Yeah. Jane, I think we have to do the first 6 because I think it's really important to talk about. I think it's 6. Yeah, that this is a free service, and then it's not income-based. Somewhere, I think that has to be highlighted about HCP.
Okay.
So is that number 6?
Yeah.
Yeah. So
You're
sorry,
right.
I'm adding on.
Yes. Okay.
I agree with Jane. This is Jenny. In terms of uniqueness, I think that is one of the things that sets our program apart, even from, say, the regional care collaborative organizations and so forth, that, many of our partners are focused on a specific eligibility requirement within that population. And I think it does add some uniqueness.
And this is Angie. I would also argue the smaller caseload. In my previous work, I worked with pediatricians, and often a full-time pediatrician could have 2,000 kiddos on just their caseload, on their patient list, and even if they had a care coordinator within their office, not enough to go across. So I feel like that's a unique piece as well.
So we have some agreement.
We have some agreement here. So I'm going to take my facilitator hat off a second because I had a thought, one of the, and you all can agree or disagree with me, but one of the things that seems to me to be unique is that you are not just dealing with complex medical issues, but the social issues, the education issues, the other community resources that maybe the medical navigation system doesn't quite cover. Would you say that it's a broader scope of needs and priorities for those families that have children with complex medical needs? So it isn't just health and medicine. It actually goes beyond that too. Am I right? And I'm hearing nods here. So I would say if someone disagrees with that, to make a comment, but I think that is a unique piece of what you do. Right?
I agree with that. But this is Carolyn. I have a problem with restricting it to complex. It may be complex in the family's eyes, but we really make a point of saying we will take anybody. I mean, I know you have, restrictions, but we really want people to know that no need is too small.
So I hope you heard what Carolyn had to say, because we've been focusing on complex medical conditions. But Carolyn from Jefferson brought up the point that they want families to know that it's not just a complex, any need or priority that is identified with a child with special health care needs. Their HCP is there to help them with that. How does that land with you all? Okay, there's another question here. Okay.
I think maybe finish the comment on that because that switches the topic.
So any other thoughts about that?
This is Lynn from Tri-County. I would say that comes under you could maybe merge that with family centers. It's not necessarily whether it's complex or not, it's whether it's the family, the family drives what is the need. So maybe we would think it was something else, but we're using, it's that idea of being family-centered, working with families to meet the needs they identify. Maybe we're complex or not, whether it's a complex medical need, complex social situation, or neither, but just a family who can't, who needs
Find their way.
And so I think that if if we're only talking about that, if, in particular for Tri-County, that it would make sense to leave that out of the document because this is a statewide document, not just a local or one county document for complex. So,
it could be a wordsmithing thing, that it could be including complex, or it could be a range of. I mean, there could be some wordsmithing there, I think. So.
And to me, that comment and that idea goes nicely with what we agreed in the last question about matching families' needs to resources. So again, it's getting at this idea that it's need-based, that it's individualized, there's a small caseload. To me, a lot of those themes go together in describing, so we could have a higher level talking point and then get into details if we had more time with someone, for example. So we might have some sub-ideas of that larger theme. So, okay, there's 3 comments. Okay. So this one is switching gears a little bit. Was there any other comment on that particular topic before? Okay, so this one goes back to the income-based idea, and I think this is probably from the perspective of a specialty clinic. It says, from my understanding, in our county, we are income-based. It is a free service to our kids with Medicaid.
Okay, so that may be the specialty clinic. This is Angie again. We do have a sliding scale with specialty clinic. However, we won't turn away families based on their ability to pay that, and neither will UPI or Children's Hospital for providing that service. So whoever, if we're right in that that's referring to specialty clinic, we can talk about that more offline too, just to make sure that everyone is at the same place there. So.
But, and if that's not true, if there's something county specific, maybe you could add on to your comment, write in and let us know what that is.
And I think the major distinction is even though there's a sliding scale fee, they're still eligible for that service. So when we're saying income-based, we're saying if you make a certain amount, you're not eligible for this. We don't say that about specialty clinics or care coordination. So I think that that's kind of a refinement of the language.
So there's no upper or lower limit. There's no guidance.
There is guidance in terms of the copay for specialty clinics, but I think what they're saying is we are for Medicaid families. No, the specialty clinics will see families beyond those on Medicaid. There's a copay, but they still can be seen, and in addition, they won't be refused service if they can't pay that copay.
So maybe a note on this is to carefully word and craft the wording around specialty clinics and any payment.
Okay. We have a couple more comments. HCP targets families that may have difficulty accessing health care. And then another comment is, I agree with Carolyn, because we are using our family support specialists to do a lot of information-only phone calls, which may not be complex. So this person is just blending to the idea of remembering that all of our counties do information and referrals, which is not necessarily a complex care coordination case. So just bring you back to that idea. So, okay, and then we have one more comment. When we broaden the target population, it may be in essence reducing the important role that HCP does versus other agencies in the community. It also may cause a problem in that families who have children whose needs are not as complex will expect the kind of care coordination that is offered to more complex situations. I wonder if we could unmute this person. There's kind of a lot there, and I wonder if we want to unpack that a little bit. Lindsay, we're going to unmute you, and I'm wondering if you could say a little bit more about what you're bringing up here. Okay, Lindsay, you're unmuted.
Maybe she's on the phone. Maybe she's not.
Might not. She might be on audio.
And maybe she muted her own phone. Lindsay, if you muted your own phone, make sure you unmute that because we can't hear you.
We've only learned these things by our own mistakes. Right?
Yeah, we all know. Exactly.
Maybe you can read it again to us,
Yeah.
Jenny.
I was just rereading it too because it's got really two ideas. The first part of the comment is, yeah, Lindsay's writing in there only on the computer, they're not on the phone, so we'll just try to unpack it this way. So the first part of the comment is when we brought in the target population, it may be in essence reducing the important role that HCP does versus other agencies in the community. So, so it's basically lending to this uniqueness about HCP is that we target a specific population. So I don't know, Lindsay, if you're referring to the Shin population or something within that like complex cases. So maybe you could write in a little bit more about that. And then the second part of the comment is it also may cause a problem in that families who have children whose needs are not as complex will expect the kind of care coordination that is offered to more complex situations. So I think that we give the same kind of care coordination to everybody and getting away from maybe the need-based part of it. So I don't know if there's any other comments. So she's saying yes, that's what she meant, the SHIN population.
So any reaction to that comment or question?
This is Carolyn. I don't know that families compare themselves to anybody else. They're not aware of the kind of care coordination that anybody else gets. I think when we are talking and assessing a particular family, we need their needs, not anybody else. Or try.
And this is Angie. I think that this, I totally get the point. I totally hear what she's saying on that. I think it's sort of a fine line, though, and maybe it's in how it may be a little bit of wordsmithing, but I also think that it is important to acknowledge the comment before, I think, talked about information and resources, and that is a part of care coordination. And so really making an effort to make sure that if there are resources or other agencies that can do that work, that you refer them out, and that is still doing a good thing by referring them out to an agency that can also do those pieces. So that may be even more just training and other, like we can have that conversation another time. I think it's a good point, but it might just be the way we word it and how our actions after that, like what they look like with those things.
So before we leave, are there any other, yes, oh, wait a minute.
I have one other, this is Angie. I liked a lot of these. So if you can't see my paper, but I like circled most of the bullets. I like the wording here and the ideas. So I went way beyond the fourth bullet. But one of the things I really liked is the first bullet where it says professionals with specialized knowledge. It may or may not be multidisciplinary depending on your county and how your county structure is set up. But I really thought that that term, you know, that these are professionals, that is to me what makes you unique in that you do have access to trained professionals who know this population. And
can I piggyback on that? This is Rachel. One of the questions I had for folks is the term that came up 9 times in comments is multidisciplinary in the first bullet because it doesn't reflect those that responded to the survey. And so my question to all of you is that just a myth on the fact that a broad base of multidisciplinary folks with different professional backgrounds just didn't have the opportunity to respond to the survey, or because it's predominantly nurses that responded to the survey. So is this reflective, do we think, of the state? And is it a fair statement to say then across the state we have multidisciplinary professionals? I agree with you. I love the term professionals with specialized knowledge in children with special health care needs, and that encompasses everybody and isn't inclusive.
I went in on the professionals with specialized knowledge.
Yeah.
I don't know that I would use the multidisciplinary for a document.
Yeah.
But
so I'm asking the group, though.
Yeah.
I want to see what they think
Yeah.
about that because I think it's a really good point. Is like multidisciplinary versus not.
This is Kathy, Tri-County, and we would use that for Tri-County, but I think we're unique in that we're able to have multidisciplinary. I'm sure there's a lot of counties that don't have access to a whole multidisciplinary team.
And this is Lynn. I don't think that piece is critical,
Right.
regardless of who it is, if they have an expertise in the needs of this family or that child. It doesn't really matter so much to the family what their specialty actually is. So I would agree that starting with just the professionals with specialized knowledge is the key message.
So this is Jane. I think we could actually add sort of a whole public health nurse role to that, so that you could say professional specialized with knowledge of children with special health care needs and their communities, so that you could talk about how they really know how to individualize the care within their own community. So that might be a way to add that, you know, public health nurses really do have a broad knowledge of the partnerships in their community and the services in their community. So maybe that would even expand it bigger. And I think the one thing that I get stuck, and I think we've been stuck over the years, is to add the licensed piece, because we know that there are family supports that we have built into HCP, but we also know that some of the care coordination functions provided by a licensed professional have some credibility to our community partners, that you can have those partnerships, richer partnerships, as a licensed nurse or a licensed dietitian or a social worker or a family professional. So I don't know where that licensed word fits or if it does, but I think we've wrestled with that over the years.
There's another related comment, just adding on to what you're saying, Jane. So this comment came online. It says healthcare professionals. So I think, again, just this, do we need to be more descriptive about the type of professionals we need? So it's sort of lending to that similar comment.
And this is Molly. I have a different comment that I don't see reflected in here, and it may not really even be reflective of the entire state, but I think as professionals, at times we may have the ability to meet families in their own communities, whether that be at home, at provider offices, at schools, which I think is incredibly unique from other coordinators in the state. You know, having that health focus to be able to meet them there, and I would think that we would want to be cautious about using the term home visits, because we're not a home visitation program. We don't provide home care, and we don't always meet families in the home. I mean, it could be a variety of arenas in the community, and I do see that as being unique to the program.
So would that wording be meeting families within their community? You know, I don't know. Does anyone else have a thought about that aspect of uniqueness?
How to craft that?
How to craft something like that?
You could just say something around in a variety of settings, including home, school.
And it may, I mean, and that may not even apply to all of the offices.
Right.
I don't know.
Well, I wonder if we could hear from some folks online if that applies or does not apply. Is that something we should consider for the document?
Yeah. So we're considering meeting families in a
variety of
settings within their community.
And this is Angie. It was one of the bottom bullets on the previous question, where somebody alluded to that. It may be a place where you could start with rewording to
Face-to-face contact.
Face-to-face.
Yeah.
Any other online comments? So this is great. I think we really had a very full discussion related to the uniqueness, and that's kind of what we thought would be very key and important, and one of the things that you really want to communicate with this document. So I'm going to move us on, and remember that you can, there's one more comment, and then I'm going to move us on, and remember that you can also email after this any other comments you might have. Yes?
Just a quick question. The last bullet there says, not sure there is overlap. Is that in regard to the one right before that, bridge gap between health and education? Are those two tied together? Or I'm not sure what that, not sure there is overlap.
Can you clarify, Jenny?
I mean, I can go back down to the comment, but it was basically saying that they weren't seeing the overlap between those three areas. So there's like a full comment about
between care coordination, case management, and patient navigation, like responding to
the original question at the beginning.
Okay.
So that question is
Okay.
providing care coordination, case management, or patient navigation. So they did not see an overlap. They saw them being defined.
Okay.
Not sure that there's an overlap.
Thank you.
Okay, so let's go ahead and move on. And the next question kind of dovetails on some things that Angie was saying. So this question briefly lists in what situation you would typically refer a family to another agency for care coordination services. And I see that there's another comment. We'll get to that. So again, these are the themes, and all of the responses are at the end of the survey report. And you can see the most common themes, words, and comments are at the top, ranked that way. So if you want to take a look at those, and let's talk about what you would see as typically when you would refer a family to another agency for care coordination. And we might begin by focusing on the top 5 bullets, but we can certainly talk about any of them.
I would add guardianship. This is Janice.
Janice from Tri-County.
As a specialty area that would be referred out.
Would you put that under other agencies, or maybe legal?
Could be legal, yeah. I mean, it is a legal process. So.
This is Molly. I have a question about this, and I think I was confused also when I answered this. Is this getting to where we would refer a family totally out of our agency in providing care coordination, or kind of piecemeal? Well, I don't have the expertise in guardianship or legal services, so I'm going to refer them for this piece, but I'm still going to provide the care coordination around the health medical needs.
I think, this is Jenny, I think we were intentionally non-specific there because and this is just getting at maybe one of the questions we had is who do we work with, who do we partner with? And I think rather than asking who do we partner with and getting a list of community-based organizations that that particular county partners with, we thought to ask about situations where we would typically refer. So I think that this gets at that idea, and I think it also gets at the idea that many of the families we see are receiving care coordination services from multiple agencies. So I think we were trying to see, is there a pattern, are there themes to that like we may need to describe that better or look at that more closely across the state if something came out of this question. So it was really twofold. I think those were the two parts that we tried to address with one question. But you're right, it's not very specific in are you referring them for good or are you referring them for additional, like an additional resource? So, and I think it's probably good to leave that open rather than make it specific to any one situation. But that's what we were trying to get at with the question. Oh, there's some comments. Okay. Okay. So this comment is kind of getting at a gap. This is coming from the Northwest, and we haven't gotten to the point yet where we've talked about I got but I got mixed up with the other. There was another set of.
We're speaking of some comments that are coming in.
This is we meet families in a variety of settings. So that was just like agreeing with our discussion. And then this gets at a new topic that I think hasn't been brought up yet, so it's getting at a gap in our discussion, is we have a unique aspect to our program that we involve family leaders as advocates. So it's kind of getting at that involvement of family leaders. And again, not sure if that's open and applicable to all counties, but certainly some counties are using family leaders in their programs now that we have more trained family leaders in our community.
Okay. Yes,
Kathy, before the conversation's over, this is Jane. I think that somehow I'm getting back to the medical home approach and where we put this into this one-pager and how confusing it is for everybody to come up with a definition and what is medical home and what does it include and what do you do. So I guess I would like to have some sort of further conversation about, well, we just provide the components and some things that address what is in a medical home approach, like referring from specialty care back to the medical home, and then, I mean, that is just an individual approach to medical home, not the community's approach to medical home. So I don't know where we're going to get to that, and I'd really like to have 1 or 2 or 3 sentences in this document that just address that we are playing with many other systems in the community and that we are advocating to improve those systems for this population. And I don't know how we get that in there and what the wording is, if we leave medical home in there or not, but somehow it's got to be in there. So there you go.
So I'm wondering if someone, some of you have some ideas about how to craft some comments about and descriptions about the work that is done with the systems within your community. Was there a comment?
No, not that I can see. I've got to get into it.
Okay. Any thoughts here? Okay, let's go. We've got about 5 more minutes. We can extend a little bit longer.
One quick, or a couple of words to add in there maybe would be consulting and advocating for families in the broader community.
Okay. And that would go back to the uniqueness, right?
Right.
So going back to the uniqueness questions, consulting and advocating.
Mm-hmm.
So are there any other thoughts about this referring to another agency for care coordination? That's pretty specific. It appears that the most common referral back for care coordination is back with the PCP or within a system such as Kaiser system that also provides care coordination. And then some specific conditions, such as autism.
It looks like with this question, it's very county-specific to me. I don't know that you can make a broad statement.
So, yeah, I wonder, is there any?
Because we probably wouldn't refer back to, we would refer to the PCP, of course, but I don't see a lot of them doing care coordination, so I don't think we would do that for care coordination unless it was the Kaiser, where they actually do provide care coordination within the organization.
I'm wondering, would you have some statement about reducing duplication or streamlining care coordination for families? I'm going back to the comment that I think Jenny made about having some families being receiving care coordination services from multiple providers. Do you think that's true? Or maybe that's just something.
We do try to avoid that duplication. So if somebody was providing care coordination, we would look at that and talk with them, and probably either we would or they would, or that kind of thing.
So would that be a fair kind of a comment to have in the document that the HCP program attempts to avoid duplication of care coordination kinds of services? Or would that even be understood?
This is for the general public. I'm not sure they'd understand what duplication is.
Okay.
So one of the questions in the intake is that if everyone is providing care coordination, that comes more than once. And so to make, I particularly make sure that there is no one, and if there is no one, I contact the person.
Okay.
So I think just to add on to that, I think it lends back to the medical home approach because one of the tenets of medical home is communicating, ensuring that the family is involved in the communication, but also communication with all the other providers or agencies that are touching that family. So we might be able to word something about that and not call it duplication of services necessarily, but one of the things that we offer is communication with other agencies that are serving that family.
Coordination and partnering.
Coordination,
So coordination and partnering
with other agencies
are words that you would see as being important.
And this lends to that same idea. This is an online comment. When we have a family who has significant needs, we schedule case conferencing with the other partners to determine who takes the lead. In this way, we prevent duplication of services. So that lends to that same idea.
So is that something that you would see as being consistent? That you're able to do that? Okay. So I'm seeing nods about this working with other partners and sometimes hosting team conferences. So is there anything that we have not touched on that you all think would be key words, key phrases that should be in this one-page document to help families, referral providers, those in your community understand what HCP does and how unique those services are? There's something that we've missed. The brains are worrying.
And I'll just say one other thing about systems that we often connect with would be behavioral health, education, respite. Maybe we could even say something about IEPs or Early Intervention Colorado. I think that it might click with somebody looking at a document that we provide care coordination with some of these other entities like education, like behavioral health, like respite care. I don't know. It seems like it might make it a little clearer as to who we're coordinating.
Adding children to that.
Yeah.
Children's health.
Like specialty care. If we gave some examples like that, it might make it a little clearer as to what other typical partners might be there.
That could be.
Or our public health nurse, our HCP services. I don't know. Maybe it's too long, but it might be a clarifier for some folks.
So you said, Jane, early intervention schools, respite?
IEPs, or maybe you mentioned IEPs. I don't know if that is something that people would know, but behavioral health, family voices, I don't know.
I think you might even say special education.
Special education would be better. Yeah, that's better.
Probably cover.
Yep.
Any other
Legal
comments before we leave? Okay, I'm saying it again. Remember, for those of you that are thinking about this and you come up with a brilliant idea or suggestion, feel free to email those comments, suggestions, ideas at a later date.
So going into the one-pager?
We're going into the one-pager. So let's move ahead then and talk about, so we've mentioned this one-pager. And what you'll see now on your screen is that there's a one-pager outline. And the HCP team really consulted our communication experts here at the health department, and they provided an outline of the components that are commonly seen in one-pagers. Now, we may or may not have all of these sections or framework for it, but at least it gives an opportunity for us to kind of just talk about a description of what a one-pager might look like. And many times the one-pagers are front and back, so we do have some room to put things. One sheet of paper, but it might be front and back.
And it can't be 4.5.
That's right. You have to be able to read it. You're right. Right. So Jenny, I'd like you to talk a little bit about this, if you would, for a second.
So I think we took what the communication team showed us, but we also listened in a lot of these meetings where the need for this one-pager came up. These questions that we put here are some of the actual questions that came up that we would try to be answering with the one-pager. So the general idea was that, we would, of course, convey a little bit about our program. Not everybody knows what HCP means, and I think we shared some evaluation data earlier this year where there was a lot of confusion when we were asking families, who's your HCP care coordinator? They're like, I don't know who HCP is. So, I think internally we throw that term around a lot, but is it clearly communicated to the families and communities that we serve what HCP is and what that stands for. So that was a pretty big thing that came out, I think, all throughout the year in our evaluation activities. What services do we provide? Again, I think this just lends to the consistency across the state of our partners knowing what to expect from our program. And then this question again about how do people access services. I would really say that just through our website, our program receives between 10 and 15 calls a week from parents trying to find out like how they can get services from this program. So of course our preference would be that people are going to their local public health agencies first, but I think that this document could also help us speak to parents about how do they access this program and lend a little bit of direction to that initial search. And then, of course, who do we partner with? I think this came up in this last question that we were talking about is who do we work with, who do we partner with, and then if somebody needed more information, where would they go? Like, do we direct them to the local public health agency website? Who's the contact person? That kind of thing, again, came up as just like, you know, we get a lot of questions about that. So these were typically questions that came up a lot about our program, either through evaluation, through meetings, through discussions, and then some of the things we might be trying to answer through this document.
Is there anything that needs to be added to this, or that you might not agree with? So in addition, is there a gap in here of what really you feel is important to be in the one-pager? Or do you feel like one or more of these should not be included? I'm giving you the negative opportunity to.
I think it's a really good start.
Okay, we're having some head nodding and some agreement that it's a good start.
I just want to mention one thing that, this is Janice from Tri-County, and one thing that was mentioned that you would assume that people would go to their local public health agency, and I don't think that's the case.
Mm-hmm.
I don't think families that have kids with special needs even think of going to public health typically. I think that they come to us through referral from a variety of different agencies, healthcare professionals, but not through the route of the public health agency typically.
Because it's something that we want to communicate.
Yeah.
So did you know this document?
Did you
where
know
how we want people to do that? I mean, it's a question, I guess.
Yeah, that could be a whole campaign.
And that's what this document can be part of the campaign, to let partners in the community know, let families know. So thinking about once the document is produced, how you're going to distribute that. This can be.
I don't even know that a lot of people, I mean, from attending Tri-County meetings, I don't know that a lot of them know what HCP is or that we're a part of.
You mean other agencies?
No, I mean just within Tri-County Health Department. I don't know. Lynn, what do you think? Do you think it's well known what HCP is and what we do?
I think if you're old like me, it is, but
if you've been around for years.
Yeah, if you've been around a while, then you get to know, what the different programs within Tri-County do. But it's changed, I mean, too, over time. So I am sure there are staff of ours that just don't know.
And this is Angie. I've noticed that there's sometimes some difference in how different agencies refer to their HCP program, and it may not be that it's called HCP, or it may be called something a little bit different as well. So even if they're, so I guess the question becomes, if a family does go, I'm going to call my public health agency, what are those words that they're using that somehow get them filtered to a person who provides HCP services? So that's a good point.
So I'm wondering, I'm looking at Jane, because I sit next to her and I hear the phone calls she receives from families with children with special health care needs. What are your thoughts on how to...
Yeah, I don't think any of them would know to start with the health department, their local health department. I think that they are looking at a broader need and don't have any real idea how to get that need met in their community. So, and I always, as you guys know, refer them to you because you would know better how to serve those folks. And so, I mean, sometimes I'm able to answer their questions specifically, but most of the time it's about services at the community level that they're wanting, and that's where I direct them. So, or some other access to care issue like becoming a CNA and providing services to their child at home, or where do they start with that kind of thing. So, no, I don't think they know about local health departments. And in fact, I think that's a broader issue. I don't think it's just with HCP. I think that if you go to a small community, I'll give you Gunnison, for example. It's right in the heart of the little, college town, and they are, they know to come there for immunizations and family planning and infectious disease and HCP and WIC and all those things are in one basic office in the county system. And so the community probably is aware of them and might call them if they had a health care need in the community. But in a bigger community like Tri-County or Jefferson or Denver, it's not a well-known entity. The health departments are there and that what they provide.
So I'm wondering if this is another topic that needs to be discussed. One, keeping it in mind is the one-pager is being developed, but who and how to market this to. But keeping the language, being aware of the language in that it's going to speak to not just the families, but how the family's going to get it. So it would be your other partners in the community. So that may be, we've got
There's a couple of comments, and I just want to reiterate what Angie said. I mean, maybe this document also helps families what to say when they call. When calling your local public health agency, mention the following keywords or something to ensure that you get, something. So, I mean, there could be some education coming out in this document too. I support that. Okay, a couple of the online comments. We have a flyer in which we say assist family with support needs, i.e. early intervention education systems, parenting classes, respite resources. I can send you our flyer. I will note that it is old and needs to be updated. So that's from Amy, Antuna and Wells. And then just a comment, 504 plans are not part of special education, so I think this is going back to who we partner with, and HCP just did a webinar about how to keep the health in these conversations in school, and that's how we can represent and add value to those discussions. So I think that lends back to that. And there was another comment that said I agree with that. Directing them to local public health agencies would be beneficial. A local contact would be a great beginning for families. So that might be a way that a county might individualize or custom one-pager. We are planning on visiting doctors' offices. We have made a flyer and will distribute our business cards as well. We could also use the one-pager with those visits. We are increasing our meeting attendance with local agencies who can provide complementary services. So this is just talking about how they might use the one-pager to strengthen their partnerships in their community.
Jenny, I had a quick question. Does HCP have a list on the website of all the local offices and the content for parents?
We have a link that says find your local public health agency. We have specialty clinic contacts, but we don't have like all the care coordination contacts for every town. Mostly because there's so much changeover that it's hard to maintain it on a website. But even Jane and I, for example, are working on improving the HCP website at the state level, making it more family friendly according to the number of calls we get, just having more resources for parents, where to get started. And so we do want to make a button that like find your local public health agency, so it's really easy and it kind of becomes the first step for families rather than calling and having to talk to us and then we end up referring them to their local public health agency anyway. So we're working with ways to find that, make that more clear on our website.
And I've heard of other programs kind of creating links to sites that everybody can update, like an open source concept. So it wouldn't. So it would be like the agency's responsibility, for example. update any staff changes along the way. But then that way every agency could have an actual person and a phone number. Because when I call a government agency, even working for CDCDG, I press 0. I don't have the patience to try and figure out who you're supposed to talk to.
Yeah.
So I'm sure families who are under all the stress go through the same thing. It would just be nice to have a number, a direct line.
And that's really, this is Angie, that's where my comment came from when I get a call from a family. I go to our website, I click on the local provider link, I put in the county I want, and sometimes I'm like, oh, if I give them that number, are they going to know what to say and how to get to where they need to get to?
So it sounds like just hearing a resounding, we need to do a better job of helping our families understand how to access our program or how to connect with our program.
Or the community.
In general,
right. Yeah.
So one other online comment that just came in, it would be helpful to explain to our families that we hold our specialty clinics out of our local health department, and that's true with the exception of one site. And also explain that HCP staff coordinates these clinics at our local hospital. So that's the other piece of that. So it's just explaining, again, how to access those services. Yeah. But that the local health department is that point of contact, I think, is what they were emphasizing. Okay.
So this is Jane. Maybe we have some frequently answered questions, or frequently asked questions about need more information, and we could say a couple of things like that. Frequently asked questions would be
in the one-pager?
In the one-pager. Or I have a link to it, and then have that go to our page, and then we update that page. But because frequently asked questions might be, where do you hold your specialty clinics, or who do I contact at the local level, or how do I become a CNA for my child within the home, or, anyway, maybe we can add some of those to our, at least maybe even a link or to our website.
Okay. So do we want to summarize some of the highlights that we learned today with your conversations? And again, thank you so much for being very open and frank and the comments that you made. So we'll take a look.
Could I propose something? So originally we had planned on typing as people are going all the comments, but I think there were a lot to try to capture. I think Nancy and I are both typing and capturing, but we're also recording everything. So I think what I'd like to propose is that we get together and type up a summary of what we've agreed and then send it out within the next couple days so that if there are gaps, if in reading everything there are gaps, people can get back to us fairly quickly. And then if that part is okay with everybody, then we can go into the next step about how we might finish this one-pager.
So I'll just ask for any other comments, suggestions, ideas around the table here.
This is sort of unrelated, but it goes to the very first question. For years, I have seriously, but not too seriously, suggested that we change our name to Healthcare Partners for Children with Special Needs, because so many people get confused when we say programs and think we are an insurance company. And I have a really
great
hard time with
idea.
that. And I really think we need to consider that.
And you're being serious now.
I am being very serious.
I just wanted to check that out. So I hope you all heard that on the phone or your computer, that Carolyn from Jefferson is seriously offering a suggestion that there might be a name change to Healthcare Partners for Children with Special Needs.
And that's an effort to keep the HCP. That's kind of been branded. I like that. One of the things at the state, we've been trying to figure out, even amongst the 4 of us that work for HCP, we all introduce our program differently. Some of us say program for children with special health care needs to avoid that confusion that we're a health care plan, because we do get a lot of calls from families looking for us to help reimburse services for their children. So I think there is some confusion about what that term means or what the name of our program means. I do think it might be a lot to bite off for the next 10 minutes to try to get to a place where we could discuss it. But maybe if there's enough people that feel this is an issue, maybe this is a follow-up discussion that we have, again, with all the counties that are implementing HCP participating about what is the best way to identify ourselves, because it would kind of be key to finishing this flyer, if we're going to say what that program stands for, that we get some resolution on that. Is there enough interest around the table or online to have a discussion like that? Is it warranted to change the name or reevaluate the name of our program? Yes, they're just coming in. Like,
Yes.
Great idea.
Yeah.
And around the table?
Yeah.
Yeah.
Yeah, they're just they're filtering in.
All right.
Several. Yeah.
Well, it looks like we hit on something today. Thank you, Carolyn.
And thanks for the initial suggestion of what that name might be.
Yeah.
Yeah. Might be your legacy, Carolyn.
I know.
I got to do something.
Okay. And if there's not anything else, if there's no other comments, then I would say let's go ahead and move to the next step.
Okay. And I'm not sure if we said this in the beginning, Kathy. I know we had talked about it a little bit, but our process today and our meeting purpose was really to get input and to try to get a little bit of consensus on the content for this one-pager. And we knew going into this meeting that it was not going to be possible to wordsmith and write out the whole one-pager. So what we'd like to do is we'd like the HCP team to take at the state to take all of this feedback, all the comments, all the descriptions that resonate with folks that participated today, and we'd like to try to come up with the first draft. And then what we'd like to do is have a few of our colleagues to be that first sounding board, colleagues that participated in the meeting today, but maybe people that haven't been represented in one of our other work groups this year. We've had, over the past year, we've had quite a few focus groups, work groups, and we want to ensure that everybody has a voice in the components of the HCP program. So what I'd like to do is to ask those of you that have not participated in a work group or focus group and are interested to be the first sounding board for this one-pager, if you could send me your name via email. I'll also, we keep a spreadsheet of everyone that's participated in a work group. So if we don't get enough names, we might reach out to you and say, hey, we haven't involved you in our program improvements this year. Would you be willing to spend a couple hours to review, help us edit the document, and I think most of all, help us ensure that the document's reflective of the conversation that we've had here today. So I'd like to propose that as a way to finish the document in a timely way. The second thing I wanted to propose was a timeline that we try to do this by the end of January to have a finalized document. If we go into a discussion about what we call ourselves, that timeline might not fit. But certainly I think we could shoot for having a final document, even if it means the name is not yet finalized by that time. So that's the timeline that I'd be looking at. Any objections or additional ideas that we might want to think about in terms of that process of finishing the document? Does that sound good to everyone about a way that we could finish it in a timely way? Okay, so if you're interested, send me your name. A couple people are already writing it online if they're interested. So again, I'd just be asking for people that haven't been in one of our other work groups or focus groups so that we can make sure everybody has a chance to give input.
So that would be the first round. So would you kind of do just sending that around with like a comment period or something after that, or
yeah,
like how would that go out to the rest of the?
That's good. So I think after the first initial group had a chance to refine and edit and ensure that the document's reflective of the conversation we had today, then I think the next step would be to send it out to everyone who participated in this conversation today to have a second glance at it, see if there's any gaps, anything we missed. And then, you know, I think we would share it out to everyone in the program after that. So does that, thank you, Angie, for bringing that up.
Okay. So checking to see if there's any other comments coming in. Does that sound okay to this table? Does that sound like a feasible plan? Well, I think we can wrap things up. So today was a challenging, but we were so pleased to get all the conversation because that's what we hoped would happen. And we realize that it's not as easy when you're not in the room to be able to make comments. And we thank you for your typing skills and and your responsiveness and making it somewhere in the snow. So I'd like to just review a little bit and find out from you what you thought the meeting, how the meeting worked, how this facilitated online and in-person meeting, what went well with the meeting. Do you feel like you had enough opportunity to comment?
Yes. What went well was the queue on the
So sitting around the table, we have a little white sheet of paper, and Carla would hold it up with a Q, means there's a question. It took me a couple times to get it, but I did. So thank you, Carla. Anything else? How could we improve this meeting? Oh,
You got 3 comments.
Okay, let's hear it. Let's hear the comments.
Yeah, positive meeting. I found it easy to comment online, like using this meeting format to type in.
It seemed like a good combination of people here in the room and adding in the ones that were using technology to access the meeting.
I can say, this person likes the webinar format and promptness of facilitators in answering questions. Thank you. And then, great meeting, thank you.
Okay.
This is Jane, and I'm just really glad we have a wider variety of folks input into the HCP program, and it was really nice to have, not that the old HPACers aren't great, but the other folks that joined us today, it's really nice.
Anything we can do to improve if we do this again? This conversation meeting, rather than fly you all in.
Which today wouldn't have been a good day.
It wouldn't have been a good
Great dedicated drive.
I guess we could plan the weather or something like that.
I guess I'm just wondering if those on-site could hear everybody talk.
Yeah.
That's an issue sometimes.
So maybe the question is, instead of everybody saying yes, 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 was there anyone that had difficulty hearing? So if you comment on that, if you just say, I did, that means you had difficulty hearing, because we do have one polycom in this room and a lot of people commenting.
We had, as far as the audio, I haven't heard anybody say they couldn't hear.
Okay.
A couple comments that they did hear fine. Someone said they didn't receive an agenda. Some voices were louder than others, but I was able to hear everyone. Overall, it was easy to hear.
Good, good. That's what we were hoping. So, great. So again, thank you, everyone.
Yeah.
And we hope to hear from you even more so. So again, feel free to send any other suggestions.
Yeah. And I'd like to thank Kathy on behalf of the HCP program, because she did an excellent job going through all the information, preparing for this meeting, and just agreeing to take her time to facilitate today. It was excellent.
Thank you. My pleasure.
Thank you, everybody.
Okay.